Hi, it's Dr. Doug Curtis.
And Lucy Curtis from Dyslexic and Unstoppable. Our mission is to help dyslexics rediscover their inner power. And today we just want to talk about a little thing that happened at the office, right?
Right, yeah. So yesterday I had a patient, and I can't remember exactly. She was in the early grades, first, second, third, something like that. And, I started talking to the mom about how school's going. And, first she talked about, well, she's getting some reading help and she's having a little bit of difficulty. But the one thing she brought up is the teacher is questioning whether she has ADHD. And so of course, since we've developed that whole tool for parents with dyslexia versus ADHD, it kind of perked my interest there. So the things she said, well, she has a lot of trouble paying attention, and she sometimes jumps out of her chair, and occasionally she can act a little oppositional. But then we started to talk about, because you always say, what's the context? Where does this happen? And it happened only when she's doing reading,
Red flag, red flag.
Exactly. So, we started to go on, and I said, well, look, we can evaluate her for ADHD. We can do that, but I would be very reluctant to even consider medication for a child like this. She needs the help in the reading. But the funny part of it is we have the survival guide, for parents of children who are struggling in elementary school. And we talk about all the associated issues that go with it. And as we're, saying goodbye, and I'm talking to the mom says, okay, to her daughter, she says, okay, get your shoes on. And so I just look out of the corner of my eye, because I know some of the signs and things we look for. And sure enough, as she's trying to tie her shoes, she has difficulty. And rather than tying them the regular way, she ties them with a two-loop way, And we always say, kids with dyslexia, right, connect the dots.
Connect the dots. And it doesn't mean that she has dyslexia. It could be a different learning issue. Right. But for me, it really brings out the red flag is, you said, she's really good at math. She doesn't struggle in math. At home, she doesn't have difficulty focusing. And it shows up in reading, and she's getting help in reading. So for me, that always doesn't mean it's dyslexia, but it is a red flag to say, you can't say it's behavioral at this point. You cannot say it. That they really need to investigate it a lot further than that. To me, it's not the right time to make a decision for that, right?
Right, exactly. So anyway, just an interesting story. It's nice to see how our tools and strategies can help out in the real world,
especially at that stage. This is where we're really focusing on these early signs, and where to go from there, and what to do from there. And everybody has their little their specialty and their place in this big dyslexia environment, right? And this is where our flags go up, because we live it, and we're living it, we lived it, and we've been through it, and we see it, and then when you see with your patients too, it's like, whoa,
It's interesting. So anyway, just an interesting story. Leave us a comment below. Visit us at dyslexicandunstoppable.com, and
our book is coming out.
Yeah, coming out in a couple days.
April 7th will be everywhere on all the bookstores and Amazon and Barnes and Nobles and all these things. So check it out.
All right, thanks a lot.
Thanks.